And welcome back. My next two guests have been working on a treatment to help those living with a debilitating neurological condition known as upper limb spasticity. Joining me now via Skype is Dr. Peter and Cary McAllister. Welcome, guys.
Good morning. Thanks for having us.
Oh,
Hello.
thank you for being on the show. I'm looking forward very much to this segment, so I really want to dwell right into it. So tell me exactly what is upper limb spasticity?
So upper limb spasticity is a tightness or twisting of an arm in response to something that happened in the brain. So the most common cause is stroke. So if one has a stroke, and I'm sure many of your viewers have seen folks or have families with stroke, the arm can be twisted, can be pulled in tight to the chest, and the problems are pain, tightness, and inability to use the limb properly. That you can't pick up things, you can't take care of what you need to take care of, particularly if it's your dominant hand. For most of us, that's the right side. So it comes after stroke, traumatic brain injury, spinal cord injury, and we even see it in children and adults who have cerebral palsy. So it's a condition that's caused by a neurological insult to the brain, and it's got a lot of functional difficulties.
Right. So how does a ULS impact the lives of those who suffer from it?
So if you can imagine your arm twisted, bent, and basically stuck, it paralyzes people. It causes people to walk without a normal sway to their arm. It causes people to not be able to toilet, to go to the bathroom, to feed themselves. Activities of daily living, the things that we take for granted that we normally do every day, are very, very difficult for a person who suffers from spasticity.
Okay.
And another problem is when the arm is twisted in that position from the stroke long enough, the tendons shorten, the muscles get so tight, and that can lead to something called a contracture, in which the arm is permanently stuck in a position where the elbow is flexed, the fingers are tucked down into the palm, the thumb is buried in the palm, and you can imagine the fingernails digging into the skin of the hand actually can cause skin breakdown and infections. So it's definitely something that needs treatment.
I see. And what are some of the ways that you can treat ULS with physical therapy?
So when I see a patient with upper limb spasticity, I typically assess first for pain. Most of my patients suffer some kind of pain from upper limb spasticity. And then I look at function. So the goals are always to increase independence in all functional tasks. We stretch the limb, we strengthen the antagonist, so the opposite muscle that's contracted, we want to work and strengthen that. We want to do functional tasks such as bed mobility, transfers, brushing of the teeth, eating, and work on the training to make those things easier. We also work on gait training. So we want, again, the arm to be swinging so the trunk rotates, and so gait is more normalized, and people feel more comfort, have less imbalances in their muscle, and have less pain.
Okay, so are there, I guess what I'm trying to understand is that people that, this only happens with people that have a stroke or something? That, are they born, can they also be born with this, or?
Yeah, there are children who have cerebral palsy, which is a lack of oxygen to the brain when they're born. Some children have a cord around their neck or whatever it is. They will have this too. So it's basically multiple insults to the brain of any sort. Stroke is just the number one. There are 800,000 new cases of stroke every year. So the most common thing that comes into my office as a neurologist is someone who's had a stroke and their arm is initially flaccid and just floppy and paralyzed. But then with time, and for reasons that are not entirely clear, the brain makes these muscles tighter and the arm contracts. And as Caryn was saying, when you have an inability to use the hand and it's contracted, it can be painful. The deformity is obvious to everybody if you're walking in a mall or visiting with families. So there's also a psychological part of having upper limb spasticity. So the way we approach the treatment is to educate the patient and tell them that there's something that can be treated. A lot of folks who have had a stroke or a brain injury and their arm isn't functional and twisted and held at their side think they're stuck with this. And one of the messages I hope to get across today is you're not stuck with this. There are things that we can do through a combination of medicines, some injectable and some pills, and then good physical therapy, adopting a holistic approach to try to get the patient more functional and give them some gains that they wouldn't have had otherwise.
Okay, and what are some of the medical treatments that they can use to treat ULS?
So in the old days, we really had pills that are muscle relaxers. And diazepam, old brand name Valium, is one, but anyone who knows the medicine Valium knows that it can make you so darn tired and lethargic by the time it starts making your muscles looser that it's very impractical in most folks. So over the last 10 plus years, we've been fortunate to have a number of what's called botulinum neurotoxins that are injected. So these are very safe molecules made in a plant. There's 4 of them on the market currently, and they're injected with a very small needle into the very tight muscles. And what happens is the medicine goes down to where the nerve connects to the muscle, and it causes the muscles to relax. So if you can imagine your biceps super flexed and your arms stuck in that position, once the medicine is in, after a week or so, you're able to loosen that up. One of the studies we were involved in was a medicine called Xeomin by a company called MERS Pharmaceuticals. Their product was shown in a large study in which we injected half the folks with the Xeomin in the arm muscles and half got water injections. That's called placebo. Okay. And it's a double-blind study, meaning the patient didn't know what he or she was getting, and I didn't know what I was injecting. It could have been water, it could have been the medicine. And we had an independent rater, in this case it was Caryn, the therapist, to look at who responded. And that's the way science works. And what we found was that the Xeomin injected into the muscles caused the muscles to loosen up, caused the fingers to come out of the palm, caused the pain to go down, and gave the patient some more sense of what they were kind of like before the stroke and before the TB.
Well, listen, Peter and Caryn, we actually ran out of time, but I really want to thank you for bringing to the light the ULS and all the studies and everything. So hopefully there'll be a cure someday for it, right? That's what we're all hoping for. So
we're working on it.
Thank you so much for being on the show, and keep us updated, okay?
Thank you, Eraldo.
Thank you.
Thank you, guys. All right, Healthy Lifestyle with Eraldo returns in just a moment.
See, I like how you do